Hi students, now we are going to discuss about ophthalmia neonatrum, one of the important high risk infections in high risk newborn. So, ophthalmia neonatrum is also termed as neonatal conjunctivitis, and it is a form of bacterial conjunctivitis contracted by newborns during delivery. And the baby's eyes are contaminated during the passage through birth canal from a mother, either infected with Neisseria gonorrhea or Chlamydia trachomatis. Okay. So, ophthalmia neonatum, it is also known as neonatal conjunctivitis, and it is a form of bacterial conjunctivitis, and it is happening during the time of delivery. The baby's eyes are contaminated during the passage through the birth canal from the mother, either infected with Neisseria gonorrhea or Chlamydia trachomatis. These are the main causative organism of ophthalmia neonatum. Then definition. It is an inflammation of the conjunctiva during the first 3 weeks of life, and it is termed as ophthalmia neonatum. Inflammation of the conjunctiva during the first 3 weeks of life, and it is a form of conjunctivitis occurring in infants younger than 4 weeks. Okay, so this infection is occurring within the 4th week of life, that is in the first month of life, and it is a common eye disease of the newborn. In epidemiology, the incidence is 3.1 per 1000 live births, and the high rate of transmission from infected mother, it is 50. There is a 50% of chance of transmission from infected mother during the normal vaginal delivery, and it was the leading cause of blindness during the early period of life. In the ancient periods, it was a cause of blindness among the neonates. Then causes. If it is a non-infectious ophthalmia neonatum, the causes are chemical irritants like silver nitrate solution, soap, and antibiotic drops. Okay, accidental accidental entry of these chemicals like silver nitrate solution, soap, and antibiotic drops into the eye of the neonate. Then if it is infectious, the causes are Neisseria gonorrhea, Pseudomonas, Chlamydia, Staphylococcus, and Pneumococcus, Escherichia coli, and herb simplex virus. Then the mode of infection is infected hands of the caregivers, infected birth canal, or other infected sites of the baby like skin or umbilicus. So the mode of transmission of infection is from the infected hands of the caregivers, infected birth canal, then other infected sites like skin and umbilicus. Then clinical manifestation, it depends upon the mode of infection and causative organism. The first type of conjunctivitis or ophthalmia neonatum is chemical conjunctivitis. So in chemical conjunctivitis, the onset is from 6 to 12 hours of life, and there will be mild irritation, and there will be tearing and redness. The next is chlamydial infection, because if there is a chlamydial infection, if the causative organism is chlamydia, the clinical manifestations we can see it from 5 to 14 days after birth, and the unilateral or bilateral watery discharge which become purulent. Unilateral or bilateral watery discharge from the eye which eventually become purulent or pus discharge. Then if it is a gonorrheal infection, the manifestation occur from the 3 to 5 days after birth, and there will be chemosis. Chemosis means swelling or edema of the conjunctiva. Then lid edema, then purulent discharge, then corneal ulceration and perforation. And if it is a bacterial infection, the bacterial infection, there will be the manifestation will be we can see the manifestation later because of the longer incubation period of bacteria. Then there will be redness of the eye, lid swelling. Then if Pseudomonas infection is there, in disseminated cases ultimately leads to death. Okay, if it is a Pseudomonas infection, there will be dissemination of infection to other systems too, and it will ultimately lead to death. And it is characterized by edema, erythema of the lids, and pannus formation. Pannus means there will be increased vascularity, that means the blood supply to the particular portion of the infected eye will be increased, and there will be granulation, and finally blindness or impaired vision, that is pannus formation. So if there is Pseudomonas infection, ultimately there will be death, and it is characterized by edema, then erythema of the lids, and pannus formation. Pannus formation means initially there will be increased vascularity to the particular area of infection, and there will be granulation of the tissue and impaired vision or blindness. Then endophthalmis. Endophthalmis means infection of the ocular cavity, entire ocular cavity. Then sepsis, shock, and death. Then if it is a viral conjunctivitis, it will be manifested within 2 weeks after birth. Then bilateral discharge with vesicular skin lesions. Then investigations, we have to collect the history, then we have to conduct ocular examination, then conjunctival swabs to be sent, cultures. We have to send the culture for investigation. Okay, that means we have to collect the secretions from the eye and send for culture, then conduct gram staining, and we have to collect the cervical swabs from the mother too. Then treatment. In initial therapy, we can use broad spectrum antibiotics like ofloxacin, that is 0.3% for 3 weeks before identification of the organism. Okay, in some cases, the report of the cultures will be delayed. So, up to the identification of the correct organism, up to the identification of the accurate causative organism, we can start ofloxacin 0.3% for 3 weeks. Then if it is a chemical conjunctivitis, no treatment is required. Then if it is a chlamydial infection, topical tetracycline 1% or erythromycin 0.5% eye ointment can be used. Then oral erythromycin syrup for 14 days also can be used. And the dosage is 50 mg per kg in 4 divided doses. So if it is a chlamydial infection, we can use topical medications as well as oral medications. So topical medications like tetracycline 1% or erythromycin 0.5%. Then oral erythromycin syrup for 14 days, that is 50 mg per kg in 4 divided doses. Then if it is a gonorrheal infection, ceftriaxone single dose 20 to 50 mg per kg IV or IM, or cefotaxime single dose 100 mg per kg, or ciprofloxacin 10 to 20 mg per kg. Then additionally, these infants can be treated with bacitracin eye ointment. So we can give a single dose of ceftriaxone or cefotaxime or ciprofloxacin. Then along with that, we can use eye ointment 2 to 4 hourly, bacitracin, and topical saline wash to remove all the discharges. Then if it is a bacterial infection, aminoglycoside plus local saline irrigation, gentamicin ophthalmic ointment can be used. Then if it is a viral infection, IV acyclovir for full-term infants, that is 45 to 60 mg per kg per day in 3 doses for 14 days. In viral infection, the only treatment of choice is IV acyclovir, and it can be used in 45 to 60 mg per kg per day in 3 doses for 14 days. And the most important characteristic is that this ophthalmia neonatrum is mostly affecting the full-term infants. Then prevention, we can use antenatal measures include thorough care of the mother and treatment of the genital infection. If there is a genital infection to the mother, it should be early diagnosed and treated immediately. The natal measures are important. Delivery should be conducted under hygienic conditions or aseptic conditions. Then postnatal measures like 1% tetracycline ointment or 0.5% erythromycin ointment can be used immediately after birth to prevent. If the child is under the risk of infection, if the mother is having any infection previously, we can use the prophylactic treatment at the birth itself, immediately after the birth, by 1% tetracycline ointment or 0.5% erythromycin ointment. Then single infection of ceftriaxone 50 mg per kg IM or IV should be given to infants born to mothers with untreated gonococcal infection. If the mother is having any gonorrhea or gonococcal infection, we can provide single injection of ceftriaxone 50 mg per kg IM or IV for infants born to such mothers, even if the child is not get infected. Then complications are keratitis, then conjunctival scarring, then systemic infection like chlamydial pneumonia. The nursing management is the nurse must be absolutely sure that the drops are instilled properly. Okay, installation should be ensured. Then the infant's arm must be restricted so that he or she does not rub the eyes. Then if only one eye is affected, a shield is placed over the other eye. Then purulent discharge is removed by frequent irrigation. Then prognosis. For chemical irritation, good spontaneous recovery expected after 24 to 36 hours. There will be spontaneous recovery after 24 to 36 hours in chemical irritation. Then chlamydial infection, there will be good prognosis, that is 80% recovery after one course of treatment. If it is a bacterial infection, rarely fails to respond to appropriate treatments. Rarely there is a failure in the treatment in the case of bacterial infection. So these all are about the ophthalmia neonatrum. Hope you all have understood my class well. If you have any doubt, you can ask me in the group. Thank you.